Hello, I'm presenting my first synthesized finding on intrauterine cannabis exposure and adverse effects on fetal development. During this presentation, you will hear about 3 studies that I am using in order to find this first synthesized finding. The first study that I reviewed is prenatal cannabis use and infant birth outcomes in the Pregnancy Risk Assessment Monitoring System, also known as PRAM. It is a retrospective cohort study, and the findings were that the greatest incidence of low birth weight was amongst infants exposed prenatally to cigarettes and cannabis. It should be noted that um, although the greatest incidence of low birth weight was amongst infants exposed prenatally to cigarettes and cannabis, there was also a higher risk for low birth weight amongst infants who were exposed exclusively to cannabis. Low birth weight and for gestational age were likely in infants prenatally exposed to cannabis as a whole, and incidence of preterm birth weight um, being low, and developmental size restriction were increased when both cigarettes and cannabis were consumed. However, um, the vein that remained the same for cannabis exposed infants were specifically that they saw there was an increase in low birth weight, small for gestational age, and preterm birth. The second study that I reviewed is Cannabis Use in Pregnancy and Maternal and Infant Outcomes, a Canadian cross-jurisdictional population-based cohort. This was a retrospective population-based cohort study, and the findings in this study were that prenatal cannabis consumption exposed infants to a higher risk of congenital anomalies, major congenital anomalies, preterm birth, whether it was by a medically necessary induction or a spontaneous preterm birth, very preterm birth, so those babies born very early, small for gestational age, low birth weight, and large for gestational age. So there were a variety of outcomes found for the infants. And it should be noted that prenatal cannabis consumption exposed mothers to a higher risk of cesarean delivery and also to gestational diabetes. Specifically, this study found that female infants were at a higher risk for small for gestational age delivery and spontaneous preterm birth. There is consistency with the fact that those who consumed cannabis exposed their infants to a higher risk of small for gestational age and low birth weight, as well as the risk of preterm birth. The final study that I am including in this first synthesized finding is intrauterine cannabis exposure and fetal and maternal blood flow, a case control study. It is a non-experimental case control study. And in this study, they found that only pregnancies where cannabis consumption was present experienced increased uterine artery pulsatility index and a decreased cerebral placental ratio. That was an indication that fetal and maternal blood flow changes do occur when cannabis exposure is a factor. And basically, that the fetal and maternal blood flow changes that occur with prenatal cannabis consumption are attributed to fetal growth restriction. And those fetal growth restriction does result in low birth weight and small for gestational age neonates. Preterm birth and neurodevelopmental ramifications were also found to be an outcome in this study. Upon reviewing all 3 of these studies, it became apparent that the recurrent theme in the findings was that intrauterine cannabis exposure did in fact contribute to fetal growth restriction, which resulted in high risk of preterm birth or a higher risk of preterm birth, small for gestational age neonates, and low birth weight in neonates. all these things were consistent. The second study had other outcomes, but those other outcomes were not consistent in the other two studies. So that's my synthesized finding. And this last page, of course, is my references. The articles are interesting, so I encourage you to read them. And thank you for listening. Thanks for your time.